happens if a physician proposes some kind of medical treatment or intervention like withdrawing life support, and the family member who's making decisions for the patient refuses to consent? And this is something that can actually happen all the time. The person making decisions, known as the substitute decision maker, does not have to agree with the physician. If we all had to agree with our doctors all the time, the concept of informed consent would not mean very much. So it is possible to refuse. And sometimes that's where it stops. The substitute decision maker says, no thanks, I'll pass, end of story. But in some cases, that's not the end of the story. In some cases, the healthcare provider who is proposing this treatment or intervention, whatever the case may be, they might think this substitute decision maker really got it wrong. So what then? Well, there is actually a process that the healthcare provider can initiate where they actually fill out a form known as a Form G, and they can bring this matter, this dilemma, to a tribunal in Ontario called the Consent and Capacity Board. The Consent and Capacity Board, as the name suggests, they are experts in matters involving consent to things like medical treatment, consent and capacity, where people lack capacity to make their own decisions. So this is their expertise, and a matter can be brought there by the physician or whatever healthcare provider is involved in the scenario, and an actual hearing can take place. So a hearing is kind of like a little lawsuit where the physician would represent himself or herself, or a lawyer might be involved to represent the doctor. The family member that did not want to consent will either represent themselves or have a lawyer, and there might be other people involved as well. For example, the patient might be assigned a lawyer, and the patient may or may not be able to communicate with the lawyer, and the lawyer has to kind of do the best they can in the circumstance. If they can communicate with the patient and ascertain their wishes, that might happen. There might be witnesses, like other family members who are in support of one side or the other, but this little hearing can actually take place, and the Consent Capacity Board hears evidence, hears legal arguments, and ultimately makes a decision. So at the end of the day, a substitute decision maker might be basically required to consent, even if they didn't want to. So that might sound wrong. It might sound like, well, the substitute decision maker gets to decide. How can some tribunal tell them otherwise? And the context for it is because substitute decision makers don't actually get to decide whatever they want. There are rules in place. The Healthcare Consent Act has principles that guide how substitute decision makers have to do their job. They have to follow a known prior capable wish, and I'll link to another video where we've talked about that in more detail. And if there's no known prior capable wish applicable to the circumstances, they have to follow the patient's best interests. And there's a list of factors in the law about what that means. So if they're not actually complying with the principles, it can result in going to this tribunal and potentially being required to consent, even if that was not their initial reaction. So that is it in a nutshell. What happens if the decision maker doesn't agree? There can be a hearing, and they might actually lose the ability to make that particular decision for themselves. So that's it for this video. I hope you've learned something new, and I'll see you in the next one.